Hi all, I'm back with mental health nursing. Okay, so today we are going to deal mental health nursing psychiatric emergency. I think so. I'm back with a 3 months gap, right? So today we are going to do psychiatric emergency and crisis intervention. Okay, what is psychiatric emergency? It's a condition where the person is having disorder of thought, disorder of emotion, disorder of psychomotor activities. Okay, so in this, what should a nurse do, or what are the management should be done? Okay, so the first one is suicidal threat. It is the most commonest seen in psychiatric hospitals. Okay, what suicide is a type of crisis or type of emergency where the person is deliberately harming oneself. Okay, so the etiology we can be divided into three: psychiatric disorder, physical disorder, psychosocial factor. Psychiatric disorder, the person will have a major depression because the person is feeling worthless, helpless, hopeless. So suicidal tendency is high. Schizophrenia, command hallucination is there for the patient, so person will be feeling suicidal threat. Okay, then alcohol or drug abuse, dementia, delirium, personality disorder. Physical disorder like person with any incurable or painful physical disorder is there for the patient. The person will be feeling, why should I be about burden for the family members? Let me die for myself. For example, I can give AIDS patient or cancer patient in the last stage and all. Okay, then psychosocial factors is like failure in examination. You people usually threat. You'll not do suicide. You'll just frighten your parents. Okay, so that your parents will have a fear like if I hurt my son or if I hurt my daughter will do like this, right? Then dowry harassment, breakup, marital problem, loss of loved one. Okay, then isolation from the social group, financial or occupational difficulties. Because of that, person will be having say suicidal tendency. Now what are the risk factor of suicidal tendency as the age and the sex? In the age, men more than 55 years, above 55 years are more prone to get suicidal tendency. Female in 18 to 55 years, the person female will be having suicidal tendency. But sex wise, male are greater risk of suicidal tendency. Female are just like threatening, if you'll not come I'll do this, if you not do this I'll do that, like that they will just threaten. But at the risk rate, if you see men's, because they will not say anything, they have any fear, any emotions and all, they'll just go hang or they'll just eat something. Okay, they won't share their emotion most probably. Female have the emotions to cry out and all. Okay, then having a definite suicide plan, history of any suicidal attempt. Okay, being unmarried or divorced, widowed or separated, all this can be a cause of suicidal thing. Okay, in suicidal tendency in psychiatric ward, usually it is seen as we discussed in the etiology in a manic patient, a major depressive patient. Okay, schizophrenic, drug or alcohol abuse, personality disorder. Now we are moving on to the management. See, if you get a hint the person is having a suicidal tendency, please shift the patient immediately to the nurses station, closer to the nurses station, so that we should observe the patient continuously. Constant observation will be there for the patient. Like the person is, while talking, while communicating, the person is telling that I feel worthless living here. I feel I should die myself. Why should I leave? Yeah, if the family members are away from me, or even they're making any will wish. Okay, asking their family members to close their bank account, something, or refusing to eat, drink and all. When you have a feeling of emotion, depression and all, you will not feel hungry, so you will not be eating for 1 or 2 days. If they are not eating, that means something is plan is going on inside. So shift the patient inside, immediately to the nurse station. Okay, then monitor the patient, take all the suicidal threat attempts will be there. Remove all the sharp instrument from the patient. Whenever you're going and giving medication to the patient, with the tray you'll be going, right? Drug tray will be there. Never leave the drug tray there without notice and go. Why? Because the drug tray, that this one is there, no? The end part they can sharpen and they can cut themselves. Okay, that is a major problem. Usually I've seen in hospital this occurs. And make sure that the tablet is swallowed. What happens is, like, in front of you, the person will take the tablet, and once you go away they will split it off. So what you have to do is, like, you have to make sure that the tablet is swallowed. Okay, inside the tongue, under the tongue and all, they can keep. They are very much tactful. Okay, then remove all the knife, glass bottles, stripes, clothings and all from the patient, because they can hang also. So remove everything. Then do not allow the patient to put a blot, okay, inside the door, in private room as well as in the washrooms and all. The patient should be kept a constant observation, okay. Then spend time to the patient, talk to the patient. Now what happens is, like, when you feel that you are depressed, usually when you open up to someone, you feel relaxed, right? If there is no one to talk, you will feel burdened. I'm all alone here, nobody is there to talk to me, let's do suicide. Usually that happens, right? So what happens, like, talk to someone, open up, what is your problem, all your emotion, let it come out, okay. Once you cry and all, you will feel relaxed. Then you will feel, why should I cry for someone else? Why should I cry for something which happened in my past? Let me live in my present for my better future, okay. Then if suicidal tendency is very much severe in the patient, sedate the patient with the doctor's advice, okay. This was all about management of suicidal threat. Next, we are moving on to the violent or aggressive behavior. Aggressive behavior, very anger, whatever you do, very anger, they will throw all these things, whatever they have near to them, they will throw at your face and all. So, aggressive behavior. Okay, severe form of aggressive. During this stage, patient will be very much irrational, very much irritated, uncooperative, delusion. If you know delusion, then you will understand. And visual hallucination will be there for the patient. Okay, now what can be the etiology? Organic psychiatric disorders will be there for the patient, okay. If you know what is organic disorder, then you will be understanding. Then other psychiatric disorder like schizophrenia, mania, because they have hallucination. Because of that, delusion and hallucination will be there for the patient. They will feel that someone else is there. They might be throwing something else for that person, but it will fail on us. So what management we have to give is, like, whenever an aggressive patient will be coming, their hands and their legs will be tied up, and even a bunch of clothes will be put in their mouth and all, because they're very angry, right? So what you have to do is, like, and the person is coming, remove the tied ups and all, okay. Make the patient relax, okay. That will make him, okay, somebody is there to listen to me, okay. Then tackle the patient, okay. Make the patient realize that somebody is there for him. Remove all the tight things and all. Sedate the patient immediately, okay. Then take a thorough history collection from the family. Do a thorough physical examination, and if in case if you want any blood samples and all, collect it when the person is in sedative. Later on, if you go and collect them with that syringe, they will give a punch on your face, okay. So do all those things, and while doing physical examination, if you feel that person is very much dehydrated, start IV infusion, okay. Keep the environment clean, okay. Maintain a little lighting, okay. Sound, or like sound free environment, noise free environment and all. Provided the person will be, after a sedation and all, he will be little bit okay, okay. Then encourage the person to talk. What is your problem? Why are you doing this? Did they do something and all? Just talk to the patient, okay. Then if the person is not calmed by talking down and refuses medication, restraints can be used if necessary with the doctor's advice, okay. Then guidelines for self-protecting for handling aggressive patient. Now if an aggressive patient is coming, okay, you feel that I'm okay, I can deal that patient, why I want a help, you'll go alone, okay. That person is very much aggressive, you go and hey, come sit here, you'll give one punch on your face. So never ever go alone or attend a person alone, okay. Aggressive patient should not be attended alone, okay. Keep a necessary distance, okay. I can say one hand distance. Why? Because either if they punch also, you can escape like this, okay. Then maintain a clear exit route. It's like you and one more staff is there, okay. This is the door open here, and the patient is front of you. If the patient is attacking, just say run, and you go out. Why? Because why I said you should say run is, like, that person will be thinking like you will do something, okay. So he or she will be waiting for that. If you say run, both of you can run and close the door. Don't you will run and you will make the staff there, so that the person will be attacked, the patient will be attacking the other person. Don't do that. Never leave your staff alone there, okay. Then maintain a clear exit door. Okay, be sure that the patient has no weapons with him. If weapons are there with him, do not fight. What are you doing? Oh, you are very much, huh? You will do that, huh? Come on, show me. Come on, throw at me. If you do that, then the person will definitely throw the weapon at you. Okay, and even though that pillow or that bed sheets, everything, blankets, everything he'll throw at you. Don't do like that. Just say, calm, calm, relax, relax. Keep that weapon down. I'll not do anything. Trust me, I'll not do anything. I'll not touch you. Please, please, relax, relax. Make the patient relax. Okay. Then distract the patient. Okay. Then antipsychotic medications can be given for the patient in emergency cases. So this was all about aggressive patient reacted. The next one is panic attack. Panic attack due to anxiety, the person feeling panic. At that time the blushing will be there, the person will be having heavy sweating, choking. Okay, then chest pain, nausea, abdominal distress. Okay, fear of dying will there, hot flushes and all will be going. So what should we you do is like, first thing is like, give assurance for the patient. See, maybe they will having what to say, visual hallucination, died person is coming, because of that they are seeing, or any objects they are seeing, they are having the panic attack. First give the assurance for the patient, nothing is going to happen to you. Find what is the cause for the patient for having this panic attack. Okay, then give diazepam 10 mg for the patient. Okay, 10 to 2 mg lorazepam can be administered for the patient for a panic attack. Okay, next we are going to deal with epileptic furor. Epilepsy for the patient is there, means we can sedate the patient, haloperidol can be given for the patient. Okay, this delirium tremors and all we have already discussed in organic brain disorder, so I don't want to continue around same the same thing. Then acute drug induced extrapyramidal syndrome that we have discussed in antipsychotic. Okay, and antipsychotic drug, the side effect is extrapyramidal syndrome, so I don't want to discuss again that. If you feel any doubt, you can come back to me. I have already given the notes, right? Then we are going to deal with victims of disaster, natural disaster. The person is like a disaster like earthquake, flood and all, which is unexpectedly happening. The first people will be like very much depressed. Okay, they are not expecting it, right? So the person will be very much, first anger will be like, they will be very much anger. Why this has happened to us? They will be very much frustrated. They will be very much anger. They will be feeling numbness. They'll feel like, I don't feel to eat. I feel like everything is gone, because their house they have left, their loved ones have passed, their all the clothes, all the money, all the whatever is, everything has gone. Okay, then they will be in a confused state. What will I do? That confusion and all will be there for the patient, for the person. Okay, they will be like away from their normal thing. What we have to do is like, we can give counseling for the patient. We can assure few things like either house, the government can be assured, like house can be given, job employment can be given. But yes, we can't give their loud one back. We can give certain types of assurance. Then we can conduct a group therapy. It's like the person who are victim wise, we can call them together, and a person who has overcome this victim. Okay, a person who had the same situation but he has overcome it and he has gained or something, that person you can call and you can have a conversation so that they can encourage them and increase their self-confidence. Okay, then you can either advise them for a counseling. Okay, for any psychologist, because they may having inner anxiety. Okay, to reduce that we can give that, and in coping mechanism, in certain cases, in selective cases, we can administer benzodiazepine for the patient. Okay, to reduce the anxiety. Okay, that was all about victims of disaster. Next one is rape victim. Okay, rape is like, it's an act of a person like forcing someone to have a sex with you without his or her will or consent. Okay, so after a rape victim, what happens to her, like she will be feeling everything is lost, all the world, all the future, all her aim, dream, everything is gone. Okay, she will be in the stage of numbness, depressed. Okay, self-blaming, feeling like degradation. Okay, feeling of being killed, self-blame, okay, because I went there, that's why this happened to me. Or she will be blaming God, why did you do this to me when I was like this, okay. The person will be doing derealization, depersonalization and all will be there for the person, okay. What management we can give is like, first thing, we should not be, what to say, judgmental. Oh, she's a rape patient. You'll go discuss everything. Nothing. You should maintain a pure confidentiality. Okay, when patient's history and all, then should not be judgmental. We don't know what exactly happened. Okay, we don't know what is the exact situation or emotional state and all. So we should be supportive to the patient. Okay, then give a maintain a proper physical examination for her, provide oral pill for the patient to avoid pregnancies, okay. Then send sample for STD, HIV and all, because we don't know which type of person have come and attacked her, okay. Then explain the person, like there will be PTSD, post traumatic stress disorder, okay. So once what happens is like, these people, these rape victims, it will affect their brain very badly, okay. So next time, after, if they are getting married, or if some person of coming close to her, they will have immediately, their brain will go to the flashback that this all happened. They will run away from that incident, or they will run away from that place, okay, because that fear or anxiety is there in that, okay. So we should explain this to you, and after this also you will be having post traumatic stress disorder. For that, few medication you have to take, okay. So that and all was, and later there might be some vaginal infections and all. For that, treatment should be taken, fine. So this was all about rape victim intervention and all. So I hope you understood. I have already given the notes of this unit. Please go through the notes while watching it. So in case if you have any doubt in this, please come back to me. And one more thing I have to make you reminders, like, see, our country is facing very much problem due to this pandemic COVID-19. I request each and everyone to be in your house. Okay, be safe, stay safe. Okay, be with your family so that nothing goes wrong. Pray, and now you have a good time for studying because you are at your home only. Only thing you have to use your mobile. So I know you people are using mobile very much. So instead of going to the social media for all these things, just find at least 1 hour daily for the studies, so that you will not be away from the studies, okay. I hope you all understood. If there is any doubt, please get back to me, okay. Take care, bye, have a nice day, bye.